Hey everyone, and welcome back to the channel. Today we're diving into a super important topic for all of us cat parents out there. Our feline friends are masters of disguise, especially when it comes to hiding pain or illness. It's an instinct that served them well in the wild, but in our homes, it can make it tricky to know when something's wrong. So, today we're going to uncover the subtle and sometimes not so subtle warning signs that your cat might be trying to send you. Ignoring these could lead to serious problems, so grabbing this knowledge now is one of the best things you can do for your furry family member. Let's get started. First up, let's talk about one of the most common and often overlooked signs: changes in litter box habits. This is a huge one, guys. If your cat suddenly starts urinating or defecating outside the box, it's not because they're being spiteful or trying to punish you. This is a major red flag. It could signal a urinary tract infection, which is incredibly painful, bladder stones, kidney disease, or even arthritis that makes it difficult for them to get into a high-sided box. Likewise, if you notice them straining to go, visiting the box more frequently, or crying out while in the box, it's time for an immediate vet visit. For male cats in particular, a urinary blockage is a life-threatening emergency. So rule number 1, any change in potty habits warrants a call to your vet, no exceptions. Next, let's look at their grooming habits. Cats are famously fastidious creatures, spending a good chunk of their day keeping themselves impeccably clean. So, if you suddenly notice your cat's coat is looking greasy, matted, or unkempt, that's a significant warning sign. A cat that stops grooming might be in pain. Think about it. If their mouth hurts from dental disease, they won't want to groom. If they have arthritis, contorting their body into those pretzel-like grooming positions becomes painful. It could also be a sign of underlying illness that's just making them feel too sick and lethargic to care. On the flip side, over-grooming is also a problem. If your cat is licking themselves bald in certain spots, it can be a sign of stress, anxiety, allergies, or even parasites like fleas. So, pay attention to that beautiful coat. It's a great barometer of their overall health. Now, let's talk appetite and thirst. This might seem obvious, but the changes can be subtle. A sudden loss of appetite is always a cause for concern and can be linked to a huge range of issues, from dental pain to kidney failure or even cancer. Don't just assume your cat is being a picky eater if they turn their nose up at food for more than a day. But what about an increase in appetite? A ravenous cat, especially if they're not gaining weight or are even losing it, could be a sign of hyperthyroidism or diabetes. The same goes for their water intake. While it's great for cats to stay hydrated, a sudden dramatic increase in thirst is a classic symptom of kidney disease and diabetes. If you find yourself filling the water bowl way more often than usual, it's time to get it checked out. A good tip is to measure how much water you put out each day to get a baseline. Let's move on to their energy levels and social behavior. You know your cat's personality best. Is your usually playful, zoomy cat suddenly spending all day sleeping in a corner? Is your typically cuddly lap cat now hiding under the bed and hissing when you approach? These changes in behavior are a huge form of communication. Lethargy, or a significant decrease in activity, is a non-specific but very important sign that something is wrong. They just don't feel well enough to engage. Hiding is a classic sign of a cat in pain or distress. They're trying to find a safe, quiet place to be left alone because they feel vulnerable. Conversely, a normally aloof cat who suddenly becomes clingy and vocal might also be trying to tell you they don't feel right and are seeking comfort. Any drastic shift from their normal personality is your cue to start investigating. Another critical sign is any change in their vocalization. Is your cat meowing more than usual? Is the sound different, perhaps more urgent, pained, or just plain weird? Unexplained yowling, especially at night, can be a sign of pain, anxiety, or even cognitive dysfunction in older cats, which is similar to dementia in humans. They might be disoriented or confused. A cat that cries out when you pick them up or touch a certain spot is clearly telling you, "Ouch, that hurts." Don't dismiss new or unusual sounds. Your cat is using their voice to send you a direct message, and it's our job to listen and try to understand what they're saying. It's not just cat chatter. It could be a cry for help. Let's discuss their physical movements. Pay close attention to how your cat walks, jumps, and carries themselves. Do they hesitate before jumping onto the couch or their favorite cat tree? Are they taking the low road more often, avoiding jumps they used to make with ease? This is a classic sign of arthritis or an injury. Joint pain is incredibly common in cats, especially as they age, but it's often missed because they're so good at hiding it. You might also notice a limp, a stiff gait, or a reluctance to be active. Maybe their back legs seem weak, or they have trouble navigating stairs. Any change in their mobility, no matter how small it seems, indicates they're experiencing discomfort. Helping them with joint supplements or pain management prescribed by a vet can dramatically improve their quality of life. Now, for something you might not think about often, your cat's breath. Go on, get a gentle sniff next time they yawn. Cat breath is never going to smell like roses, but if it's unusually foul, that's a big warning sign. A particularly nasty, foul odor can point to significant dental disease like gingivitis, infected teeth, or stomatitis. These conditions are extremely painful and can prevent your cat from eating properly. Sometimes a sweet or fruity-smelling breath can be an indicator of diabetes, while breath that smells like ammonia or urine can be a sign of serious kidney disease. So, that bad breath isn't just unpleasant, it's a potential window into your cat's internal health. Let's also look at their eyes and nose. A healthy cat's eyes should be clear and bright. Any discharge, whether it's watery, goopy, or colored, can signal an eye infection, a blocked tear duct, or an upper respiratory infection. You should also look for cloudiness, a change in pupil size, or if the third eyelid is showing. Similarly, a cat's nose should be clean. Any nasal discharge, sneezing, or congestion could be a sign of a kitty cold, but if it persists, it could be something more serious like allergies or even a polyp. Don't just dismiss sneezing or runny eyes as minor issues, especially if they're accompanied by other signs like lethargy or loss of appetite. Finally, unexplained weight loss or weight gain. This is a crucial one. Because we see our cats every day, gradual changes can be hard to spot. If your cat feels lighter when you pick them up, or you can suddenly feel their spine and ribs more prominently, it's a major red flag, even if they're still eating well. As we mentioned, weight loss can be a symptom of hyperthyroidism, diabetes, kidney disease, gastrointestinal issues, or cancer. On the other hand, unexplained weight gain can put your cat at risk for many health problems, including diabetes and arthritis, and could signal a less active lifestyle due to pain or a metabolic issue. A great habit is to weigh your cat every month or so to keep track. You can do this by weighing yourself, then weighing yourself while holding your cat, and subtracting the difference. So, to recap, we're watching for changes in the litter box, grooming habits, appetite and thirst, energy levels, vocalizations, mobility, breath, eyes and nose, and weight. It sounds like a lot, but it's really about being tuned into your cat's normal baseline. You are the person who knows your cat best. You're their guardian and you're their best advocate. Never feel silly for calling the vet over something that turns out to be nothing. It is always, always better to be safe than sorry. Catching these problems early can make a world of difference in treatment outcomes and your cat's quality of life. Thank you so much for joining me today to talk about this vital topic. Our cats give us so much love and companionship. The least we can do is learn to speak their language and listen when they're trying to tell us something is wrong. If you found this video helpful, please give it a thumbs up and consider subscribing to the channel for more cat care tips. And don't forget to hit that notification bell so you never miss an update. We'd love to hear from you in the comments. Have you ever spotted one of these signs in your cat? Sharing your experience could help someone else. Thanks again for watching, and give your cat a little chin scratch from me. See you in the next video.